Watch till the end to see Attorney Muñoz's insights. Think about the last time you were in a hospital emergency room. Can you think about that? Maybe you were there for yourself, maybe you were there for a loved one. Either way, there's a distinct memory I feel like everybody could relate to, right? That feeling, the sterile smell, the fluorescent lights, the sense that everybody around you is moving too fast and knows something you don't. I feel like we all had times when we were thinking like that. But now imagine you're a nurse, right? You've been in that room thousands of times. It doesn't scare you anymore. You know exactly what to do and you do it without thinking. You draw blood from a patient's arm. You've done this thousands of times, right? You check the syringe, check the sample, and something is wrong. The blood looks wrong and it smells wrong. And before you can say anything to anyone, you collapse. And that actually happened in a real emergency room on a Saturday night in 1994. And by the time anyone figured out why, it was already too late. This is the story of Gloria Ramirez and what happened the night her blood sent an entire, almost 30 healthcare professionals to the floor. Gloria Ramirez never got an explanation. Her family never got one. The hospital workers who collapsed that night never got one. Many people never ended up getting an explanation. And that is something that I want you to really think about. The only physical evidence that was able to prove anything was thrown in the trash before anybody could save it. And the official conclusion, the one that medicine eventually landed on, was that the healthcare workers who collapsed had essentially scared themselves sick. Mass hysteria. Before any of this, Gloria Ramirez was just a person living her life. It was remarkable in the way that people closest to her said she's the kind of person that makes ordinary life feel warmer just by being in it. And people who knew her, they agreed that that was the most accurate thing anyone could say about her. She was quick to laugh. She was the kind of person that strangers felt comfortable around. She had this warmth you can't teach or can't fake. You can just feel it in her presence. But Gloria had also been carrying something really heavy. She'd been carrying cervical cancer. In 1991, 3 years before she died, Gloria had a pap smear. It came back flagging precancerous changes, and according to the lawsuit her family filed, as reported in news coverage of the case, Gloria was never told about those results. The hospital said a call was made, but the family said no call was ever made. By 1994, Gloria's cancer had advanced significantly. The window for early treatment, if had ever truly been open, had closed. On the evening of February 1994, her husband noticed she was having trouble breathing and called 911. The ambulance came and she was taken to Riverside General Hospital. February 19th, 94. Think about what a Saturday night looks like in the ER. It's busy, it's loud, there's always too much happening, and the staff was there. They've seen everything. So when the ambulance pulls up just before 8:30 p.m. and brings in a woman who is barely conscious, labored breathing, heart rate all over the place, the team moves, and it moves fast. What they do is they put the IV line in, the oxygen mask on, heart monitor hooked up. A nurse named Susan Kane steps in to draw blood. She's done this thousands of times. She inserts the needle, watches the syringe fill, holds it up to check the sample. The blood has an oily film in it, like something is sitting on top of it that shouldn't be there. And there's a smell. It's very sharp, chemical. It was described to be somewhere between ammonia and garlicky, something directly coming out of the syringe. When Susan Kane leans closer, she passes out. Within minutes, the room starts going down. A second nurse smells it and she passes out. Dr. Humberto Ochoa, the physician running the room, looks into the syringe himself and he sees something he has never seen in his entire career. Tiny crystals floating in the blood, like almost solid. He also notices Gloria's skin, that same oily film and that smell. It isn't just in the syringe, it's also coming off her body. He calls the internal emergency and the ER gets evacuated. Gloria is moved to a tent in the parking lot. The team keeps working on her outside. In February, in the cold with whatever they have. But unfortunately, she passes away at 8:50 p.m. Around 23 hospital workers reported symptoms that night: nausea, dizziness, fainting, trouble breathing. 5 were hospitalized, and some dealt with health problems for months later. And not one person in the hospital could tell you what had just happened. When 23 healthcare workers collapsed in the same room on the same night, someone has to figure out why. What happened? The California Department of Health and Safety opened a formal investigation. The Riverside County coroner performed an autopsy. Lawrence Livermore National Laboratory, a facility known for mostly nuclear research, was brought in to help figure out what was going on. Why did almost 30 healthcare workers passed out? Using Kane's draw, the one with crystals, the oily film, the smell, the only physical piece of evidence from inside that room, it had been thrown out. So it made it almost impossible. Investigators worked with what remained. So eyewitnesses, symptom reports, and Gloria's body. The autopsy pointed to end-stage kidney failure, a known complication of advanced cervical cancer. Her official cause of death was kidney failure secondary to cancer. That explained why Gloria died. It did not explain, though, what happened with the people in that room with her. Leading theory, the one that Lawrence Livermore put forward, the one that got reported most widely, was this. Investigators believed Gloria may have been using a compound called DMSO at home, dimethyl sulfoxide. Some people use it as a topical pain reliever. It has a very distinctive garlicky chemical smell. They suggested that when the administrator team gave Gloria oxygen, the DMSO reacted to that. They theorized that when the ER team administered oxygen, it reacted with the DMSO already in her system. The DMSO could have converted the compound into something called dimethyl sulfate, which is toxic. They theorized these two components reacted with each other, which caused the dizziness, the nausea, and the fainting the staff described. The problem is when investigators tested what was left of Gloria's biological samples, they found no DMSO, not a trace. So the theory made chemical sense, but it was never backed off. There was no proof. So the conclusion went somewhere else. The investigation eventually concluded that some of the workers' symptoms were likely caused by a psychogenic illness. It was concluded that it was mass hysteria. The argument was that the fear and urgency of that night, watching colleagues drop, smelling something wrong and not knowing what it was, they suggested that it had triggered a physical chain of reaction. That some of the staff had become sick, not because of something in the room that was actually harming them, but because their minds convinced their bodies that something was toxic. These were trained nurses and doctors with years of experience. In an emergency room, they had worked for years. The workers who were hospitalized did not accept this. One nurse, identified in multiple news reports, developed hepatitis and a serious bone deterioration in her knee after that night. She was out of work for months. And other affected staff filed a lawsuit knowing that what happened with them was real and physical, not panic. Whether they ever got justice for that is not something the public record makes clear. But what is clear though is that 23 people walked into that room healthy. They walked out sick. Some stayed sick, and what they told was that essentially everything was in their head. While all of this was playing out, the investigation, the theories, the lawsuits, Gloria's family was waiting to bury her. Riverside General initially held her body, citing the ongoing investigation. According to news reports from the time, the family waited nearly 2 months with this grief, with this confusion that had nowhere to go. They also sued. The lawsuit alleged that the hospital's failure to communicate Gloria's 1991 test results had directly contributed to how far her cancer progressed, and ultimately to her death. The question at the center of all of this was pretty simple. Did the hospital do what it was supposed to do for its patient? What came of it isn't something the public record tells us clearly. What the record does tell us is this: Gloria's family never felt they got a real answer. The workers who were in the room never felt they got one either. Everyone who was close to what happened walked away with the same feeling of they don't know what ended up happening. The official versions of events covered what was convenient and left everything else unanswered.
The case of Gloria Ramirez is almost beyond belief. It's true, it really happened. Some medical malpractice cases are straightforward. For example, performing a surgery, closing the incision, and then leaving inside a sponge or a medical instrument, or cutting off the right foot when they should have cut off the left foot. Those things really do happen, and they are easy cases to handle because the main issue becomes, what are the damages worth? Gloria's case isn't like that. It's full of issues. It's like a law school exam with 101 issues. The main issue we would initially focus on is the issue regarding the pap smear. Through our investigation, we might be able to prove that Gloria's doctor never informed her of the abnormal pap smear result, or that the doctor's office failed to ensure that there was appropriate follow-up. Standard medical practice requires communicating the abnormal results to the patient, documenting the communication, and recommending appropriate follow-up care. The argument is that if the abnormal pap smear result was communicated to Gloria, she would have received early treatment, and early treatment would have prevented progression of the cervical cancer. Without treatment, the disease progresses into advanced cancer, and that's what ultimately led to her death. And all of this other stuff about toxic fumes coming from her blood, it's interesting, but it's more difficult to form the basis for a successful malpractice recovery, except for the issue of discontinuation of care. Did Gloria suffer because her care was discontinued? Could she have been saved if the care was not discontinued, etc.? Gloria's case took years of litigation, and it ultimately resulted in a confidential settlement. At Gonzalez Muñoz Law, we take on these type of cases in order to help balance the scale to ensure that no one has to fight big institutions alone. It's the core of what we do.